Good morning. We're here. Welcome, bienvenue. My name is Helen Scott. I'm the Executive Director of the Canadian Partnership for Women and Children's Health, CanWaCH. We're a coalition of over 100 Canadian organizations working to improve health and nutrition in over 1,000 communities around the world. CanWaCH members include universities, NGOs, and hospitals, working with the support of and in close partnership with Global Affairs Canada. On behalf of our CanWaCH members, I'd like to welcome you to our nation's capital. As you can tell, we are jubilantly shedding our winter clothes and welcoming the warm spring weather and the beautiful sunshine outside today. I would like to also acknowledge that we are here today gathered on the land which was traditional Algonquin territory. So, as you know, we're all here today because conversations about global health outcomes are uniting around adolescence as a key to achieving the Sustainable Development Goals and the Every Woman, Every Child targets. In support of these priorities, and as a part of a global roadmap of action for adolescent health, CanWaCH is delighted, thrilled, to co-host this conference with Every Woman, Every Child, the Partnership for Maternal Newborn Child Health, PMNCH, and the World Health Organization. I'm thrilled to be on stage with these two amazing women. I also welcome our supportive partners from Women Deliver and the Lancet Commission on Adolescent Health. And I would like to acknowledge the generous support of the Chateau Laurier, which made it possible for us to host this event in this beautiful, historic venue. And importantly, welcome to the Youth Council members and the many young leaders who've joined us today from all around the world. Over the next few days, our goal is to work together to set a path to unleash the power of a generation. I'm pleased to be joined, as I mentioned, by my two colleagues, and these are two women who know a thing or two about unleashing power. I'm delighted to welcome Ms. Helga Fogstad, the Executive Director of PMNCH. She has decades of experience in public health, including working in many developing countries at subnational and national levels, as well as at international levels with multilateral and bilateral agencies. A health economist, she has been central in providing technical guidance on Norway's health, education, research, and development portfolios, both through bilateral channels and through global initiatives. Welcome to Ottawa. It is also my pleasure to introduce Dr. Flavia Bustreo, although she needs no introduction in this crowd. Dr. Bustreo is the Assistant Director General for Family, Women's, and Children's Health at the World Health Organization. Among her many roles, she represents WHO on the board of Gavi, the Vaccine Alliance. Importantly, she plays a leadership role in the development and implementation of the United Nations Global Strategy for Women, Children's, and Adolescents' Health, the one that was launched in 2015 and its predecessor in 2010, which everyone in this room, we know, knows well. So I'm humbled and honored to be on stage with both of you, and it's my pleasure to turn the stage over to you to welcome our guests.
Thank you very much, Helen, and thank you very much. Good morning, everyone. It's wonderful to be back in Ottawa with this fantastic sun, as you said. It feels like the coming of age. And I'll explain in the 3 minutes I have what do I mean with coming of age. I feel we are really at the cusp of a very unprecedented moment of opportunity for unleashing the power of our generation of young people. And investing in adolescents is something that has not been yet a priority for many governments, for many countries, and yet it has the potential for truly enormous benefits. Enormous benefit for the health of the young people, the adolescents themselves, enormous benefit for the health of their children, the future generation, and enormous benefit for the adolescent during their life course. So as they become healthy adults and therefore productive individuals in society that can give returns. But we also have challenges to confront for this to happen. As of today, we have launched this new adolescent framework with new data, and we know that still 1.2 million adolescents lose their life every year. We calculated 3,000 every day. And it's really time that we confront those deaths, that we confront the causes of those deaths. That includes things like road injury. So here is the health sector, but also other sectors that have to come into place into confronting. They also include, very, very importantly, mental health issues, self-harm. And we know also that a lot of the mental health issues during our lifetime, they start during adolescent period. We'll have more time to discuss on the causes, on what can be done. But just on this moment, why do I say coming of age? This country has been instrumental in turning the page for beginning the reduction of maternal and child deaths in the world, because it's from here that together in the G7 initiative, we launched the Muskoka initiative, which made a tremendous movement. And so it's my hope that here today, we change the course of history for what happens to those adolescents, to those young people that are the futures, that carry the future. Et donc, vraiment, j'aimerais d'abord vous remercier, Madame la Ministre.
I would like to thank you, Madam Minister. It is thanks to you and to your determination as well as your team that we are here to change the course of history. Thank you very much.
Ladies and gentlemen, PMNCH is pleased to be co-organizing this conference with CanWaCH and WHO, and also the Government of Canada. Merci beaucoup, Canada. I don't know of any other Prime Minister that's also Youth Minister, and also is that handsome. This is great. It is wonderful to be back, because we were here also in other points of our journey on the global strategy, which were the Muskoka initiative, many things that really have been critical for Canada, by Canada. So this has been very exciting. PMNCH has a strong adolescent constituency that is engaging to create a powerful movement at national, regional, and global level, driving change by adolescents, for adolescents, with adolescents, to be change agents not only for themselves, but for each other. Viva! Viva! It is not difficult to understand the need and importance of such a conference and the enormous potential for economic growth. You don't need to be a health economist to say this. Economic growth and social development in countries with large youth population, given the right investments in human and social capital for youth development, are clear. Only in sub-Saharan Africa, the right investments with the combined demographic dividends will be at least $500 billion per year for up to 30 years. Gender equity, equality, female empowerment, and sexual and reproductive rights are important. Paired with economic and social benefits is the human face, the individual case. Although probably no adolescents in this room, what we all have in common is that we were all once upon a time an adolescent. We all have felt the trials and tribulations in this critical time of our lives and know how important both physical and mental health is. A support system around you, a family, a society that can be there. This conference brings with it important evidence updates, discussion for action, and agreement in how we take this forward. It is important that stakeholders across sectors, across age groups, across constituencies, to come together to unleash the power of a generation so important and valuable. I wish each and every one a fruitful and productive conference. Thank you.
So I remember back in a few months ago when the CanWaCH team initially started to plan a conference around adolescent health. We knew that this was a critical demographic dividend to address if we're going to achieve the Sustainable Development Goals. What we didn't know was that a few phone calls would snowball into a global conference like this. But I think that signals the importance that we all see in addressing the double discrimination that adolescents face and that adolescent girls in particular face. The 4 pillars of this conference are sexual and reproductive health and rights, nutrition, mental health, and data. These were carefully selected through a consultation with many of you, our CanWaCH members, and with the esteemed Conference Program Advisory Group. As well, the Conference Youth Council, comprised of 10 remarkable young changemakers from around the world, have meaningfully contributed to the content, the program, and the communications of this conference. I can't wait for you to meet them and all of the other young leaders joining us here today. A big thank you to everyone who worked hard to pull this conference together. Outcomes of this conference will lend to increased awareness, effectiveness, and accountability of Canadian organizations, including our CanWaCH members, as they will be able to leverage the new knowledge, the networks, and the evidence-based solutions that we will learn about and discuss and explore over the next few days. These will positively impact our activities, contributing to improvements in RMNCAH around the world. This conference is a pivotal point in the global roadmap of implementing the adolescent health strategy. And it's a part of a succession of upcoming events that are building toward elevating adolescent health as a key focus area to achieving Agenda 2030, including Canada hosting the G7 in 2018. So we're very excited to kick this off. And as we welcome Canadian leadership on adolescent health and we look towards next year where Canada will be center on the global stage, it's my honor to introduce everyone to the Honorable Marie-Claude Bibeau. She's a Minister of International Development and La Francophonie. Bienvenue. I don't need to say this in this room, but she has been a global champion for the health and rights of women and girls, including their sexual and reproductive health and rights. I'm thrilled that you're the honorary chair of this conference. It has been my pleasure and our pleasure to watch your leadership and dedication to our collective efforts over the past 2 years. And I know that I speak on behalf of our members when I say that we are optimistic about what we are going to accomplish together over the next many years. Bienvenue.